Well, we certainly talked about a lot of things, and we want to stress that cardiovascular disease is a leading cause of death in the United States. And there are a lot of risk factors for cardiovascular disease that you should hopefully have gotten through this discussion, and that lifestyle changes and diet and exercise are important. Food is medicine, knowledge is power. We hope we've shared some power with you today to help reduce your risk of some of the complications that can lead to cardiovascular disease.
Welcome to our podcast. The better you are, the better you are. Whether it is physically, mentally, or spiritually, when you know better, you can do better. And when you do better, you'll be better. On this podcast, we share knowledge, expertise, opinions, and experiences. All things that can help you to change the game. By the time we're done, it's hard for you not to be encouraged. So join us.
Make sure you do appropriate dental hygiene. Floss, brush your teeth, all those good things. Stay away from a lot of candy. It can cause cavities. But your dentist will always tell you all those things for prevention.
And you bring up good points, and Dr. Dungy, I'd like you to tell us about periodontal care and what is recommended, because I think, as Dr. Love Davis points out, pregnancy often is a time that we have a captured audience and to express to them the importance of dental care. What age do you think it should start? It's not just for the pregnant mom, it's for her family as well. What age do you think it start? How often things? I will tell you a little secret. I used to have, 16 pinpoint cavities because I sucked on these mints that I thought were healthy when I was young, because I thought mint is not candy, it's a healthy thing. And I had to be educated about that. So what?
So you're asking me, when should the person go to the dentist?
Yeah, what age? What age, is there an age
Since
limit?
we have some obstetrics here, obviously once the child is born, we are expecting that the pediatric dentists, our pediatric doctors are examining things. The child won't even get teeth for usually about 5 or 6 months, right? Because then you're going to hear a term called a pediatric dentist or a pedodontist. And who do they see? They see people who are from born to maybe 2 or 3 because they specialize in that. And if you see something, it's usually seen by the parent or the provider that says, hey, this looks a little strange. Can you look at this? At about 3 to 4, you will venture out into the general practitioner's office. And because that it's like how at what age will a child sit down and let you examine the mouth, clean the mouth, apply fluoride or what have you. And it seems to be around 3 is a place that a lot of places will start at the general practice session. So I don't want people saying, he said don't go till there's 3, because then the pediatric dentist will be all over me and say, that's not the rule. So, but that's usually what you would see. We rely a lot on the parents at that time. Just, are you brushing your teeth? If you see anything strange, come on in. And we'll tell you if we can handle it or if we send you to a specialist. Then, as far as kids go, there used to be a time when you had juvenile periodontitis. And we're not seeing that as much, or at least it's not been as a big a consideration as it was back in the 80s. Usually, because I think the word has been out, especially in the schools, hey, brush and floss, don't eat these certain things. So I think educationally, we've done a good job of getting that out to the kids and then thus to the parents, right? So then you get all your adult teeth about age 12, 13. So now they become subject to the same thing as whatever age a person can get periodontal disease. And usually kids don't have much because the body is healthier then, and it can deal with misgivings a lot better when you're younger than when you get older. You'll start to see some really good signs of it. Oh, don't get me wrong, if you don't take care of your mouth, you'll see it. I'm assuming that you are making an effort, trying to brush, trying to floss. And then after about 18, you have the college or the vocational patients who life gets busy now. I can't, Now 2-minute brush turns into a 45-second brush, and it used to be 2 times a day, and now it's once and maybe when I can get to it. Flossing goes out the window. And again, your body is still healthy enough. We start to see some signs. And what are signs? Signs are gums that bleed, gums that are a little bit swollen. Those are the first signs of gum disease. And again, don't talk to your friends and say, well, yeah, my gums bleed too, so that must be normal, right?
Yeah.
Right? And so, but the only way you can tell gum disease is you have to take x-rays, you have to measure that space we talked about where the popcorn gets stuck, right? And there's certain numbers, I could bore you with that and say 0 to 3 millimeters, that may mean something to you, it may not. But we know that when you hear these numbers, you'll start to hear 4, 5, 6, 7, 8. Those are not good numbers, right? 3 to 0 is good. 4 and 5, you know, like that pre-diabetic thing. But after 5, you really run into some risks that won't happen fast, but really start to put the tooth at a disadvantage. But treatment can still be done, and we can still work with that. And what are the treatments is basically, let me put it in simple terms, that think of your tooth and that gum around it as just little garbage cans, right? The smaller the garbage can, the easier it is to clean it out. You know, if you have a little garbage can at home, you dump it, you can wash it, you can polish it, feel real good about it. But now you go outside here and you got those big garbage bins that the truck has to pick up. I mean, that's what a pocket starts to do. It starts to get bigger and bigger. What else happens when a pocket gets bigger and bigger? You have 2 different, I'm going to simplify it, 2 different types of bacteria, those that breathe oxygen and those that don't need oxygen. And the ones that don't need oxygen usually are the worst bacteria that affect your mouth. And so when that pocket gets bigger, oxygen doesn't get to the bottom, so you have all those bad bacteria. So the only way is to try and clean them out on a routine basis. And that's when the doctor says, hey, go to your dentist. Hey, let's make sure things are as clean as we can before we do the surgery. They're going to start to do these cleanings that try and change the bacterial nature in that gum around those teeth. If they can do it simply, yeah, cleaning will do. If they can't do it simply, then you'll start to hear about some surgeries to try and make that big garbage bin a small garbage bin again. And the success of that, I don't know if you guys run into this, but this is something that we do and you do. It's not like we do the surgery and then you're okay, because you got yourself into the situation. So they'll come back and say, well, I did that already and it didn't work. Yeah, because you're not working, right? So the surgeries are only good as your health is. And you asked a question before about high blood sugar. The best surgeons in the world can't overcome the body not doing its job. And so if you have poor health, you're going to have problems, even if in the best of hands. So getting a physical, understanding what your body is, the blood pressure in our place is a problem too, because like you said, these epithelial cells are being banged upon, even in the sulcus, and they leak, and that's why you have bleeding. And so when it's healthy, it doesn't bleed. And so yeah, I kind of rambled on there.
That was great. That was great. Did you have anything to add, Dr. Dawson?
I think that we've spent a lot of time on all the bad diseases and all the things that could cause a problem, but I don't think we've spent enough time on necessarily how you can prevent getting all of this stuff.
Okay.
Good.
And so I think one of the biggest things is I ask patients, like, how is your sleep? Are you sleeping? Do you wake up rested? Do you wake up still very tired? Could you potentially have sleep apnea, which is one of the things we can change and not get you into the point where you have hypertension, diabetes, cardiovascular disease. How's your stress? We talked about that already. You know, patients are really good. You guys are really good about saying, oh, I have white coat hypertension. I'm like, well, yes, your blood pressure is 140/90. But if you go outside and get hit by a car, Like you're driving and you get hit. What do you think your blood pressure's gonna do? It's gonna go up. And so I was like, we've got to get this under control. The other thing is diet and exercise, which we've talked a lot about. You know, what are you doing? My patient's like, I don't have time to exercise. You have time.
Mhm.
You schedule it like you schedule everything else. On your lunch break, take the 10 minutes and do a walk and the other 50 minutes to eat. Do that twice a day. Walk with your children because you're setting them up for healthier habits. And that gives you a chance to talk to them. I have a 13-year-old. He never wants to talk to me. So our walks are his chance to get it out. And I'm not looking at him because we're walking so he can say things that maybe he doesn't want to say to me eye to eye. The other thing is making sure you're doing strength training. As women especially, as
Yes.
these two wonderful OBs will tell you, if you're not doing any strength training, you're not going to lose weight. My patients say, well, I run 3 miles a day. And I'm like, well, yes, that's great. But are you doing anything to do any strength training? Because that belly is not gonna, it's not gonna magically disappear. And then diet. The biggest thing I get is, what diet should I do? What should I eat to lose weight? And my biggest thing is, well, what are you eating? So start writing down what you're eating and then try to modify that. Like wheat bread, whole wheat bread is better than white bread. Brown rice is better than white rice. These are the things you can think about. Healthy oils, olive oil instead of vegetable oil. And so these are some of the things you have to start talking to your doctors about. And I'm really adamant that you should go to the dentist 2 times a year, even though I am frightened about this, okay? But 2 times a year is important, because if you're not doing that, then you are going to lead up to some of these very bad diseases overall, and your health will start to decline. And so if we can prevent you from having any of the stuff we talked about today, would be my ultimate goal.
Did you have any extra comments, Dr. Love Davis?
And I think a big part of that is preventing it, and preventing maybe pregnancy while we're working on those things, right? So every single time I come, and talk to a woman, each annual visit, I talk about what their plans are. Are they trying for pregnancy? Or are they not? And often they're like, no, I'm not trying for pregnancy. And then I say, okay, well, how are you not preventing it? I don't have an answer to that. And so I say, well, that's okay. You're in denial. You're trying to get pregnant. And so if we do not have these things figured out, then we really shouldn't be trying to get pregnant, because then we're in the situation that we've already talked about.
Exactly.
And so, preventing pregnancy, however you decide to do that, talking to your OB or your family medicine doctor about that is so important as we are figuring out these life things, because we're not asking you to change things overnight. But as you're working on it, let's not add another life into that until we figure that out. So I think that's my biggest thing, is just if we're not trying to be pregnant, then don't try to be pregnant.
Excellent. Dr. Pyles,
Oh, yes.
any ending comments?
Well, I want to talk about that other $49 cardiovascular risk
Okay.
assessment. That is the calcium score.
Okay.
Yes. Patients come to me and say, well, I don't want to be on that statin. That drug that helps reduce cholesterol. I want to try other things. Oh, well, we tried your diet and it's not working. Well, I don't want to be on that. Okay, I tell you what, why don't you go get one of those $49 calcium scores and come back to me. If that calcium score is over 100, you're on a statin. You're also on a baby aspirin, because studies have shown if your calcium score is over 100, you benefit long-term preventing cardiovascular disease such as heart attack and stroke with a baby aspirin, and also on a statin to lower your LDL. So that's a pretty easy test. I usually don't tell them to get it unless they're over the age of 50, because sometimes you can get normal coronary calcium score and then have a false sense of security because you haven't had time for the plaque to calcify yet. To also let people know, if they're on a statin, your calcium score will go up a little bit each year, because what does it do? It stabilizes the plaque. Plaque is stabilized by calcium. So don't get upset if the coronary calcium score goes up just a little bit while you're on the statin. This just lets you know that it's working, it's stabilizing the plaque. The other thing about obstructive sleep apnea, I think that's very important. I'm glad you brought that up, because that's one of the reasons why I get referred patients, because they're on 5 different drugs. the drugs aren't going to work. Why? Because they're not getting enough sleep. The body has not cooled down. The body needs oxygen. It just holds on to the CO2. And I always have a little bit of a joke, a photosensitive joke. Do flowers grow in your bedroom? It's a little bit of a joke. Some people get it, some people don't. The flowers need CO2 and you need oxygen from a symbiotic relationship. So I get a little chuckle every time from some of my patients. But yes, if you do not treat the sleep apnea, you cannot get your blood pressure under control. And the body just doesn't relax. And you have blood pressure really rising through the awaking phase. The platelets get very activated. You get sticky platelets, you get sticky arteries, and you can have a heart attack and stroke on your way awakening. So sleep apnea is very, very important to be treated. If not, you're not going to get your blood pressure under control.
So since we sort of mentioned that, I am not an expert on sleep apnea, but from what I know, some symptoms might be that you snore, or that your spouse or your significant other might notice that you sort of seem like you stop breathing. Or what else do people need to know that might be symptoms of sleep apnea?
The biggest one I hear is I'm tired all the time. I wake up, I'm tired, I want to take a nap, I don't feel rested when I wake up. And so they'll think that they may have thyroid disease, and not, especially if they're single and don't have anyone that can hear them snore, see how they sleep. And I'm like, well, have we ever considered maybe you could have sleep apnea? Maybe we should check that. And then especially if they have high blood pressure and it won't go down, or it's staying just a little bit over where we want, I'm like, maybe this is a good time to try to see if you have sleep apnea. So those are the big things that I tend to see more.
And also too, on the physical exam, all my patients, I measure their neck. If they look thick, I'm going to measure the neck. For women over 16 inches in circumference, it's a risk for sleep apnea. Over 18 is a risk for sleep apnea.
So you take a measuring tape and you
I
go
do it
around
quickly.
to there, and if it's greater than 16 around the...
For women, it's a risk.
Oh,
18 for men. Also, look in the back of the throat. You have your uvula, that thing that kind of wiggles in the back of your throat. If that touches the back of your tongue, okay, that starts to get abnormal. If it doesn't touch, that's considered a 1. We call it a Malipathi's class. It's a 1. If it starts to touch your tongue, it's a 2. If it obstructs your tongue, if your tongue obstructs it and you can't see it, that could be a 3 or 4. 3 or 4s are a risk factor because you know when you're sleeping, all these muscles in the back of your throat relax, and that tongue can go over that windpipe and stop you from breathing.
I will say, I also don't know a whole lot about it, but I know that Reggie White, who was a fantastic player for Green Bay, died of sleep apnea. So it can save your life to be diagnosed and properly treated. It can cause hypertension, and I just want to, we're not going to go into depth in that, but I want people to know if you think you're at risk for CPAP, see the appropriate doctor. You need a sleep study, and then you have treatment. It includes CPAP and things that keep you able to breathe and not die in the middle of the night or have complications. And it can reduce your need for blood pressure medications and reduce your blood pressure, reduce your risk, therefore, of cardiovascular disease and the whole thing we're here talking about tonight. Anybody have anything else to add? That was excellent.
I would just say that in sleep apnea, it usually starts out with like some kind of CPAP, and patient doesn't like it, and eventually gets to us, the dentist, to make an oral appliance. And the whole point of the oral appliance is to pull the chin forward, which pulls the tongue forward. The thought is the tongue is sliding back, to your point, and obstructing the air. So as this pulls forward, tongue pulls forward, there's more airflow. I would just say that if a person's snoring, you might think the tongue is falling back in the spot that's not allowing them to get air properly. But you still got to go to the doctor first. Don't go to the dentist and say, make me an appliance, because that's out of order. It's out of order.
Well, we certainly talked about a lot of things, and we want to stress that cardiovascular disease is a leading cause of death in the United States. And there are a lot of risk factors for cardiovascular disease that you should hopefully have gotten through this discussion, and that lifestyle changes and diet and exercise are important. Food is medicine, knowledge is power. We hope we've shared some power with you today to help reduce your risk of some of the complications that can lead to cardiovascular disease. We want you to know that it's important to see your care providers, whether it's a dentist, a family medicine doctor, an OB-GYN, or cardiovascular doctor, on a regular basis, and that the better you are, the better you are. So go out there with strength and victory and with the knowledge that you have.
Thank you for listening in today. Weren't you inspired, encouraged, and uplifted? We hope so, because we're praying the best for you. Join us again next time for more betterment, because the better you are, the better you are.